Hi and welcome. My name is Dr. Sam Sunshine. And in today's short video, I'm going to be talking about meditation. I'm going to do my best to just explain more about what's called mindful meditation, some of the health benefits. And the hope is by the end of this video, I can plant a seed in you that you start your own meditation practice. And I'm really trying to encourage all my patients to do some form of relaxation, whether it's meditation or prayer during the course of the day to kind of help us all calm down. So one of the questions I ask all my patients in my intake form is rate your level of stress on a scale of 1 to 10. Most of my patients are over 5. And I really think we need to take a look at this. I think it's very important. It's one of the 4 pillars of health. There's stress reduction or stress management, nutrition, exercise, and sleep are really the cardinal pillars of good health. And stress reduction is one of them. And meditation is just one of many ways to reduce your stress. So I'm going to do a PowerPoint presentation so you can follow along. And certainly if you have any questions at the end of the video, you can send me your questions. So I really enjoy doing these talks. And so another thought is if you ever have questions or an idea of a talk you'd like me to put together, please don't hesitate. So the title of this video is Meditation, the Health Benefits of a Meditation Practice. And so what is meditation? Again, I'm going to be talking primarily about one particular type of meditation. It's called mindful meditation or mindfulness meditation. And there is really no consensus about the definition of meditation. It's kind of however you want to interpret that as being, but it's a form of mental training. And I kind of look at it as learning to play an instrument. Meditation is something that you practice and you train your mind to be alert, but relaxed and focused. In the East, meditation is an ancient practice developed to broaden consciousness and to enhance health. And that's where I think meditation has to be linked with this idea of health and well-being. And that's the purpose of this talk. It's used for the recovery and maintenance of health that dates back more than 3,000 years. So again, we've all heard the term meditation, but very few people that I know practice meditation on a regular basis. So I'm here to kind of plant that seed. Again, some common definitions. It was originally derived from the Sanskrit word, which is the Indian language. The word is dhyana, which means attention and contemplation. Attention and contemplation. Various practices consist of temporary withdrawing attention from the outside world and going within and really focusing on your breathing. There's also mental and muscle relaxation with a reduction in thought. So you try to not think while you're meditating, but be relaxed. And we'll talk a little bit about that. But that's something that you learn as you practice medicine, is how to kind of tune down all these thoughts that we normally have during the course of the day. And a lot of people that I know as patients have a difficult time turning off thoughts before they go to bed, because it's just an ongoing concert of thoughts that kind of infiltrate our mind. And part of meditation is learning how to relax that thought, those constant thoughts that are coming in. So when I meditate, it's this picture more on the right. It's I sit. I don't sit in the lotus position, but the guy sitting in his chair, I find that's more comfortable for me. I used to sit more in the lotus position, but now my hips are a little stiff. So I just sit in a chair with my hands either folded in my lap or my hands on my knees. And then your eyes are closed. You have an upright posture, but you're not rigid. And you're breathing primarily through your nose, and your eyes are closed, and you're in silence. And that's the benefit. You're not speaking, you're not listening to music, but some people do listen to an app on your phone that kind of gives you a guided meditation. They tell you what to do, to breathe in, to breathe out, etc. You can be anywhere when you meditate. You can be in your home. I like to sit outside when the weather is cooperative, which in Southern California, there's a good bet that any day of the year, you'll be able to sit outside. And I just try to sit comfortably. But the nice thing about it is you can be anywhere. And so what are some of the benefits of a daily meditation practice? So it can be done anywhere. I apologize. It's free. It doesn't take much time, so 5 to 10 minutes, and it becomes easier the more you do it. Initially, if you sit down, 5 or 10 minutes can seem like an eternity, but the more you do it, that time's going to be less. And then there are phone apps. So this first picture comes up is Balance. This is something that's free for the first year. This is the one I'm currently using. There's also Insight Timer. Another one is Headspace. Another one is Calm. There are many. These are just some of the ones I've used in the past. So how do you meditate? Again, I kind of mentioned this, but you sit still, you relax, and you pay attention. So part of that is paying attention to your breathing or paying attention to a feeling, or you pay attention to thoughts as they come in and then hopefully leave. You try not to attach yourself to any thought or emotion. And this is kind of a little relationship between meditation and focus, and also meditation is a way to kind of train our minds to be more relaxed and more alert. And then training your mind to be more relaxed and alert allows us to be more focused. And so everything's kind of works to help the other out. Here's a quote by 𝐌𝐞𝐝𝐢𝐭, and it says, mindfulness, and this is that topic of mindfulness. People, what is mindfulness? But it means paying attention in a particular way on purpose in the present moment and non-judgmentally. So again, most of this talk is just about mindful meditation. And again, it means paying attention in a particular way on purpose with intent, focusing really on the present moment. And what you'll see when you meditate oftentimes is you'll start to think about something that happened the day before or an hour ago, or you may find yourself fixating on something that may happen in the future. And it's really important just to try to be in the present moment. And then people say, the silence is really emptiness, but it's really where oftentimes we find answers. So it's after a 10-minute meditation or a 20-minute meditation that we open our eyes, and something that maybe we've been struggling with in our life, coming up with the right words, making a decision that's an important decision in our life. A lot of times those answers will come after a meditation. It's very interesting. It's been shown to be that way. This is just a pun on that, where meditation, because some questions can't be answered by Google. And I think meditation can be thought of as a way to open up space in our thoughts to allow the answers to come. So I think that's kind of cool. So when we think about what are some of the health benefits of meditation, we have seen in research that we see stress relief, anger management, control over anxiety, improved awareness, improved concentration, and improvement in cognitive skills or thinking. So when we review the research, and really it's been over the last 50 years, there's been research in the area of meditation to see what are some of the physiologic changes, what are the changes that happen in our body or in our brain that we can quantify or analyze and understand. And there are a couple types of meditation that have been studied. There's the concentration meditation, which is attention is focused on an object until the mind quiets its thoughts, and it produces this relaxation and mental clarity. There's also the mindfulness-based meditation, which I'm talking about mostly, which is perceiving thoughts without judging or reacting. And then it helps unravel this conditioned behavioral patterns. And that's the other thing, is we tend to think about ourselves and situations as being fixed. And sometimes meditation helps to change these inherent behaviors or thought processes that we feel are just cemented and unchangeable, but meditation allows for things to unravel or to change. So I'm going to start talking about some of the research that's been done in meditation going back to 1970. And this was Robert Keith Wallace. This was published in Science, in Journal of Science, which is a very reputable journal. And what he found is that during meditation, there's a drop in oxygen consumption by the body, and there's a reduction in heart rate, and there's also an increase in galvanic resistance of the skin. They also look at electroencephalograms where they put those electrodes on your scalp, kind of like they would put electrodes on your heart to measure your heart activity. They have electrodes they put on your skin over your head to measure brain waves, and have shown that when people are meditating, we're primarily in an alpha wave state. And alpha waves are generally, you close your eyes, we tend to go into an alpha wave. It's not sleep, but it's not activity or active thinking. And so that was kind of a breakthrough. That really started an interest in meditation for health reasons. And this is Richard Davidson, and he wrote an article or published a paper in 2003 talking about alterations in brain and immune function produced by mindful meditation. And he demonstrated that meditation activates areas of our brain associated with well-being, and also showed that it increased immune function. In 2005 at Harvard, this Dr. 𝐶𝐽𝐲, using an MRI of the brain, showed that meditation is associated with increase in cortical thickness of the brain. This was of the cerebral cortex and other areas of the brain where attention and emotions are concentrated. And these changes in the brain could improve a person's cognitive and emotional function and possibly slow brain aging. So when I tell that to patients, it does catch their attention. Again, it can increase cortical thickness. It can improve person's cognitive and emotional functions and slow brain aging. So that in and of itself is a great reason to think about, okay, how am I going to plan to do my daily meditation, right? So you can benefit from these proven effects of meditation. So as we go along, now we're in 2009, this is Jeff Dusek about the mind-body meditation. And this is a model of the comparative clinical impact of acute stress and relaxation response. And again, showing a reduction in anxiousness and a calming effect or relaxation effect from meditation. This is a picture of Dr. Herbert Benson. He is a cardiologist at Harvard, and he's still apparently still there. And I say that because I remember reading information about him 20 years ago, and he was one of the pioneers looking at mind-body meditation, mind-body connection, and how it relates to our health. And he was really instrumental in looking at how meditation can lower heart rate and also blood pressure. But then he went on to study the effects of meditation on human physiology beyond just looking at vital signs. but also looking at how emotions can affect the promotion of disease in the human body. So negative thoughts can stimulate the body to develop disease, and how meditating can help reverse that, and using the mind to combat stress that generates physical disease. So kind of reversing that. He was quoted as saying, "Don't worry if other thoughts come up while you're meditating. Just say, oh, well, and continue." And again, he's still producing a lot of research in the area of this mind-body connection and the benefits of meditation. This is Britta Hosel, also at Mass General at Harvard, again, using MRI to look at how it increases regional brain gray matter density, increasing the concentration of gray matter in certain areas of the brain that are associated with learning memory, and regulation of emotions. So again, if you're somebody who maybe struggles with memory and you're young, this, again, meditation can benefit areas, help develop areas of the brain that are used for memory and concentration. This is by an article by Dr. Singh, The Immediate and Long-Term Effects of Meditation on Acute Stress Reactivity and Cognitive Functions in Intelligence. And again, they were able to demonstrate that a regular meditation practice reduced acute stress and improved memory and increased intelligence, the intelligence quotient. So again, when I talk to patients about that, I think most of us want improved brain function, reduced brain aging, and an increase in intelligence. And then again, getting to the end, now we're getting up to, this is 2019. This is an article in the American Academy of Family Physician. And it talked about depression and anxiety disorders and the benefits of exercise, yoga, and meditation. I'm just going to focus on the benefits of the meditation component, but I like it because they really look at, I think it's pretty well established that exercise is good for treating depression and anxiety, and yoga and meditation as well. And so a lot of research, a lot of meta-analysis and reviews looking at this. These were systematic reviews and meta-analyses that consistently showed benefit of mindfulness-based intervention, which is basically meditation, for improving anxiety and depression. Now, again, 18% of the US population suffers from anxiety, and about 9% suffers from depression. In this past year, during the pandemic, the rates of both anxiety and depression have gone up significantly. And then lastly, I'm going to close with this one slide. The thing about meditation, and this is something that I find, is you become more and more of yourself, because you learn about yourself. You learn about how your brain tends to think. And we tend to think in patterns, like in fixed patterns. And this is a way to kind of open up, I think, our thoughts. It helps us relax. It helps us stay more alert. It teaches us to go within and not be so inundated with things that are happening outside, like the news or people's conversations. And I think that learning meditation not only benefits you while you're meditating, but over time, it's going to have a lingering effect. Even after you're done meditating, you'll still feel like you're in more of a calm place. And we need to really focus on reducing this sympathetic kind of state of being that most of us are in from the minute we wake up until the moment we go to bed at night. We really need to be in more of a parasympathetic, a rest and digest state, rather than a sympathetic, which is the fight or flight. You know, we get up in the morning, we're racing to get to work, we're driving on the road, or get to work, we're anxious, we have things to do at work that we feel overwhelmed. And then we have family and friends and finances that we have to deal with that oftentimes adds to that overwhelm. And a practice of meditation really helps to give you perspective, and it helps you to become more relaxed, more calm. So again, I hope that you take this information and contemplate starting meditation practice, think about using one of those apps on your phone that I mentioned. And if you have any questions, please reach out to me. And I'd be happy to answer those questions for you.